Bismillah ar-Rahman ar-Rahim. Our lecture today about the introduction to orthopedic disorder. The term orthopedic derived from the Greek word striated and child. It was originally applied to the art of the correction deformity by Nicolas André, which is a French physician. For diagnosis of orthopedic disorder involve around the following fundamental required the good history taking, local examination, general and physical examination, and aided with investigation. We start with history. The history or his story as told by patient, and the history taking is an art. There is a certain point of importance in the history, including age, sex, onset, trauma, fever, pain, and any problem. Regarding the age, certain diseases have predilection age group, like Perthes disease and acute osteomyelitis are common in child. بينما avascular necrosis and degenerative disorder are common in elderly. TB of the bone and joint may see in all age group. Regarding the sex, like congenital hip dislocation is common in female, بينما club foot is common in male. Number 3, onset. It may be sudden or gradual. Trauma. It could be a predisposing factor or causative factor. As a causative factor, like a fracture, dislocation, or sprain. As a predisposing factor, like TB hip, Perthes disease, osteogenic sarcoma, and acute osteomyelitis. Other is fever. It may be high, as in osteomyelitis, low in TB. Pain may be continuous or intermittent, low or high. Remember, radiated pain are these often misleading the examiner, like in sciatica هو الباثولوجي in the lumbar spine ولكن the patient presented with leg pain, or patient within the hand and the upper limb pain and the pathology in the cervical spine. Regarding the examination in orthopedic, we have a 4-step. Step number 1 is examination of the gait. It is term used to describe the style of walking. This is depend on not only muscle and joint but upon an intact central nervous system, normal labyrinthine function. Walking divided into 2 stages, stance phase and swinging phase. Stance phase, this is form about 16% of the gait, and here the foot on the ground, and is including the heel trick, mid stance, and last push off. While the swinging phase, it's occupied about 14% and consisting of accelerated phase, ثم swinging through, and lastly deceleration. There is certain abnormal gait, like number 1 and target gait, in which the duration of the stance phase decrease any painful lesion in the hip, in the knee, or in the foot. Number 2, gluteus medius gait, اللي هو lurch of the body toward the affected side during every stance phase due to paralysis of the gluteus medius. Scissoring gait, leg cross while walking, مثل نسميها مشية المقص اللي هو in cerebral palsy. Number 4, step hip gait, no flexion in the hip, like in septic arthritis at the hip. Number 5, short leg gait, when shortening more than 2 inch, limb shortening either congenital or acquired. Number 6, Trendelenburg gait, pelvis will be dropped on the opposite side of the hip, congenital or old traumatic dislocation of the hip joint, أو بسبب non-union of the fractured neck femur. Ataxic gait, child walk with leg apart, like in the spinal cerebellar ataxia. And lastly, Stephanie gait, pelvis rise during swinging phase due to the stiffness of the knee. Number 2, general physical examination. A good general physical examination from the head to the toes give vital clue in the diagnosis of the most of the orthopedic disorder, particularly generalized disorder of the skeleton, like metabolic bone disease, ricket, or developmental disorder like osteogenesis imperfecta. The third step is the clinical examination and start with symptom. Symptom, the first one is the pain, which is the first and the common complaining of the patient. Number 2, swelling. Swelling, it may be preceded or following the pain. Relevant questions to be asked are site of the swelling, painful or painless, it is rapidly growing like malignancy, or slowly growing like benign tumor, it is associated with fever, child مثل infection, single or multiple swelling like neurofibromatosis. Deformity, sudden onset of deformity is usually seen in a fracture or dislocation, but long-standing deformity are usually seen in all the fracture, congenital, developmental, and even metabolic disorder. Limitation of the joint movement. In the initial stage, it is maybe due to muscle spasm, and in late stage is maybe due to either intra-articular adhesion like tuberculosis, septic arthritis, or rheumatoid arthritis, or due to extra-articular contracture like post-burn contracture, Volkmann ischemic contracture. Other things you be thought about is the limping. This could be painful like osteoarthritis of the hip or traumatic, or painless like in congenital hip dislocation or coxavara. Limb weaknesses. This may be due to limb atrophy, motor problem like muscle dystrophy إلى آخره, or due to the peripheral or diabetic neuropathy. While the sign, there's a general sign. Look for sign of anemia, fever, weight loss, etc. or local. Local sign may be due abnormality of bone or joint, which is a deformity. The common deformity are varus or valgus. El varus means that the part distal to the joint is displaced toward the midline, while the valgus means that part distal to the joint is displaced away from the midline. Kyphosis increase the curvature. Kyphosis increase the curvature of the spine posteriorly, while lordosis, it is increase the curvature of the spine anteriorly. Scoliosis, it is mean any curvature of the spine in coronal plane, I mean lateral curvature of the spine. What's mean by fixed deformity? Fixed deformity, it's mean that one particular movement cannot be complete. Thus, if the knee can be flexed fully but cannot be extended fully, it's said to be have a fixed flexion deformity. And we have structural and postural deformity. Structural deformity, it is a fixed type of deformity. I mean the patient cannot be correct it's by himself, while the postural, the deformity in which the patient himself can be correct by his own muscular effort. مثل patient with disc, واحد عنده انزلاق فيجي scoliotic spine but لما هو standing, بس لما يروح البين or لما lying down will be scoliosis will be disappear. We have 6 causes of bone deformity. Number 1, congenital disorder like pseudoarthrosis. Number 2, bone softening like ricket or osteomalacia. Number 3, dysplasia like multiple exostosis. Number 4, growth plate injury like epiphyseal separation. Number 5, fracture malunion. And lastly, patched disease. This is cause of the bone deformity. While also there's a sixth cause of the joint deformity. Start from the number 1, skin contracture like burn. Or second, facial contracture like Dupuytren contracture. Number 3, muscle contracture, Volkmann ischemic contracture, which is the end stage of the compartmental syndrome. Number 4, muscle imbalance like asymmetrical paralysis. Number 5, joint instability like arthritis. And lastly, joint destruction like arthritis. Also, temperature is important local examination. This is always compared with the normal side, checking with dorsum of the hand. And this is the most sensitive part. Tenderness. Also, this is elicited by examining from the normal to affected area. Swelling. The following things are not in the examination of the swelling. Number 1 should be deciding the anatomical plane, whether in the bone or in the muscle or in between. How you can differentiate the swelling in the bone or in the muscle or in between the muscle and the skin. If it is in the bone, the swelling will be decreased in size when the muscle is put in contraction. When the swelling in the muscle, the swelling slight decrease in the size and it is get fixed on muscle contraction. While between the muscle and skin, there is no change in the size and the swelling when the muscle is put in contraction. Also, examination the level of the swelling to identify whether it is in the epiphysis or in the diaphysis or in the metaphysis. Also, a grade of consistency and describe the shape of the swelling and looking for the sleeping sign, sign of the empty and expansile impulses. Regarding the movement of the joint, and we have passive and the active movement. Active movement, the patient himself moves the joint in one direction and later in the other. The extent of the movement is not. Both the joints should be tested and should be start within the active movement, then followed by passive movement. The joint in the passive movement, the joint is tested by the examiner without causing pain. The extent of the passive movement is not. When there is a limitation of the all movement of the joint, it is indicated arthritis. When there is a limitation of the certain movement of the joint, indicated an extra-articular lesion or mechanical lock. If passive movement exceeds active movement, paralysis of muscle is most likely. The last step is the measurement to know the limb length. For this measurement is take between the two fixed bony point and always compare within the normal. And also to know the girth of the limb to detect any wasting of the muscle. The circumference of the limb is measured at the fixed point on both sides. Example, 18 cm above the joint line in the thigh. طبعا we have two types of the shorting. There is apparent اللي هو الوهمي due to no real shorting but due to contracture like burn or like burn or paralysis. And the real أو طبعا apparent shorting when there is pelvis inadequate, not square pelvis. And the real, there is real shortening when there is يعني fractures, malunion or missing bone or any injury. A real lengthening determined by measure between the two bony points. is quite different from the apparent length, which is the patient lying in repose. This happens when the pelvis is tilted and the one limb is hitched upward. If real shortening is present, it is usually possible to establish where the fault lies. When the knee is flexed and the heel together, it can be seen whether the discrepancy is below or above the knee. If it is above, the next question is whether the abnormality lies above or below the greater trochanter. The thumb are pressed firmly against the anterior superior iliac spine and the middle finger group for the top of the greater trochanter. Any elevation of the trochanter on one side is really appear and then will be identified if there is any shortening. And we have certain 7 causes of the persistent discharging sinus. واحد عنده sinus وما يطيب whatever the management take by antibiotics. Should be put in your mind one of the following: whether in obliterated cavity or unabsorbed sequestra, or if there is epithelialization of the sinus tract. إذا presence of the foreign body راح يبقى discharging sinus. If there's secondary infection, if there's a diabetic or steroid therapy يعني immune compromise, and lastly malignant changes in the sinus. The next is the investigation, and in the investigation we have lab investigation and special investigation. These help to confirm the diagnosis and some cases help to make the diagnosis. Example, a crack fracture can be diagnosed by X-ray. The investigation include laboratory investigation consisting of the blood count like routine, hemoglobin, urine إلى آخره, or special investigation which include X-ray, at least 2 view of the affected part, CT scan, study the cross section of the limb, MRI. This is a gold standard in the investigation of the bone disorder. It's helped to study the bone soft tissue, medullary spreading إلى آخره with great accuracy. The only problem is the prohibit cost. And angiography help in the tumor marker أو diagnosis, in the tumor diagnosis. اللي شيء يهمنا هذه كله راح تاخذوها بالاكس راي. اللي يهمنا اللي هو البايبسي والالكترو diagnosis. The biopsy is important for number 1 to making a diagnosis or distinguish between local conditions that is closely resemble one another, like collapsed vertebral body, whether due vertebral compression or due to bone tumor or infection. Number 2, type of the bone, whether benign or malignant, primary or secondary. Number 3, planning of surgery after confirm the diagnosis, histopathological. Number 4, bacteriological typing. Disorder after using tetracycline labeled bone biopsy to identify the type of abnormality like osteoporosis, osteomalacia, hyperparathyroidism, and severity of disorder. Biopsy is 2 types, either open or closed type. The closed type, using a needle or trephine needle, it is the procedure of choice except when the lesion cannot be accurately localized or when the tissue consistency is such that a sufficient sample cannot be obtained. While open biopsy, when with exposure of the lesion and excise of the sizable portion of the bone. But it has been several disadvantages of the open. Number 1, it is require operation and its complication. Number 2, a new tissue is opened up, predisposing to spread of infection or tumor. Number 3, Jeopardize the biopsy incision may be jeopardize subsequent wide excision of the lesion. Number 4, the more inaccessible lesion like a tumor of the acetabular floor can be reached only by dissecting wide through healthy tissue. While the electrodiagnosis, nerve and muscle function can be studied by electrical method. فنمبر 1 اللي هو النيرف conductive. Electrical stimulation of the motor nerve normally produce contraction of the muscle supplied by that nerve. The stimulation is applied to the skin over the nerve, and the motor unit response is measured by a concentric needle electrode inserted in the muscle and displayed on an oscilloscope. If the test is repeated at 2 points, a fixed distance apart along the nerve, the conductive velocity between these points can be determined. Normal value is about 14 to 16 meters per second. Conductive velocity is slow in peripheral nerve damage or compression. If the nerve completely divides from the 14 days after injury, there is no response to stimulation of the nerve and an abnormal response to galvanic stimulation of the muscle, which means the reaction of the degeneration. إذا النيرف كوندكتيف ستدي ما نقدر نسوي إلا بعد 14 يوم من النيرف انجري، وعن طريق انه نسوي ستيميوليشن للنيرف عن طريق الكترود نحطه على النيرف، وليكن مثلا ميديان نيرف بالالبو، وناخذ الريسبونس مالته عن طريق نيدل نحطها بالمصل اللي نريد نفحصها، مثلا انه هذا ميديان نيرف، اذا مثلا نفحص البلمارس لونجس مصل which is supplied by the median nerve، ونقيس المسافه بيناتهم، وبعد ذلك نعيد نفس الفحص ولكن بمسافه اخرى، ونقيس الديفرنسز بين السبيد المفروض تطلع من 40 الى 60 متر بالثانيه. اما النوع الثاني فهو الالكترومايوغراف، هو تخطيط العضلات، ذاك تخطيط العصب. تخطيط العضلات هو نسوي constructed needle in the muscle، نجيب نيدل نحطها بالعضله which is used to record motor unit activity at rest when attempts are made to contract the muscle. اذا نخلي النيدل بالعضله بالرست، وبعد ذلك نقول للمريض تسوي contraction. Normally no any electrical activity at rest. However, إذا طلعت spontaneous discharge may be occur after partial or complete denervation with pressure on the spinal cord. لما نقول له سوي contraction on voluntary muscle contraction, characteristic oscillation pattern will be appear. In myopathy, the action potential is small, while in the neuropathy are abnormal, large, and extend. Next, about the treatment of the orthopedic disorder. We have a conservative and we have operative. Start with conservative, and first of them is rest, support, traction, physiotherapy, radiotherapy, and drugs. Regarding the support, this is enable the disease part to heal, providing rest, prevent this deformity, relieve pain, and also support the patient psychologically. Example مثل lumbosacral pelt أو corset for the low backache, caliper for the polio, cervical collar for the neck. Number 2, traction. 3, traction for the backache, cervical spondylosis. This is traction and this is traction. Physiotherapy, especially for the post-operative rehabilitation, and these include whether active exercise, passive exercise, and elective muscle stimulation. Radioisotope scan, radiotherapy. It has a role in the inflammatory disorder like ankylosing spondylitis, or in the new plastic condition like Ewing sarcoma and giant cell tumor. And lastly, drugs. And the drugs, whether analgesia and non-steroidal anti-inflammatory drugs for pain and inflammation، أو نستخدم muscle relaxant for the spasm، antibiotics for acute and chronic infection، Hormonal, like anti-anabolic steroid and estrogen for osteoporosis. Special drugs like vitamin C for scurvy or vitamin D for ricket. And lastly, cytotoxic drug for malignant condition. Next, within the operative, uncertain term should be known by every student regarding the osteotomy, arthrotomy, arthrodesis, arthroplasty, and bone graft. First of all is the osteotomy. Osteotomy is an operation by which the bone is cut to correct the deformity or to change the shape of the bone, and lastly to relieve the pain in arthritis, to redirection the load. Pre-operative planning is essential and should be include the following point. Number one, the exact site of the bone division should be near as possible to the site of the deformity. Number two, the amount of the correction required, the intending angulation, translation, or rotational shift must be measurement in degree. And lastly, the method of correction, and it's either wedge removal, which is mean close wedging, like this, or wedge insertion, like opening wedging. And method of fixation, either plaster, splint, or internal fixation or external fixation. طبعا the osteotomy has many complications. Start with general complication like thromboembolic and infection, while the specific complication, the most common complication in osteotomy is either over or under correction. Number two, nerve injury, nerve tension. Acute long bone correction greater than 20 degree should be avoided, and if there is a known risk of the nerve injury, it should be limited to only 10 degree. مثال peroneal nerve palsy after corrected osteotomy for the mark valgus deformity of the knee. Number three complication, compartmental syndrome, especially in the forearm and the tibia, and lastly non-union. The next term is arthrotomy. Arthrotomy means opening a joint, and the main indication for opening of the joint is number one, inspection of the interior or perform a synovial biopsy. Number two, when there is a draining hematoma. Number three, remove a loose or damaged structure like torn meniscus. And lastly, number four, excise synovial, inflamed synovial membrane. The third term is arthrodesis. Arthrodesis means fusion of a joint, and it is most reliable operation for painful or unstable joint, where stiffness does not seriously affect the function. Example, spine, the tarsus bone, the ankle, the wrist joint, and interphalangeal joint. We have four principles for arthrodesis: is exposure, preparation, coaptation, and lastly fixation. The exposure, both the joint surface need to be well visualized. Then preparation, both articular surface are denuded of the cartilage، لازم نشيل كل الغضروف من الجوينت. Number three, coaptation, which is mean prepare the surface are opposed in the optimal position. And lastly, fixation of the joint, whether by internal or external fixation. The fourth term is arthroplasty. Arthroplasty means surgical refashioning of the joint. Aiming is to relieve pain and to restore the movement of the joint. We have three varieties of the arthroplasty: excisional, partial, and complete, or total. Excisional arthroplasty, sufficient bone is excised to create a gap at which movement can occur. مثل removal of the head of the femur نسميها girdle stone hip arthroplasty, or exercise of the trapezium. Partial, one articular component only is replaced. يعني احنا نعرف الجوينت ب two articular surface, one of them will be removed مثل الهيد of the femur والنيك نشيله ونحط بدله prosthesis نسميه اوستن مور. او ثالثا اللي هو التوتال replacement, when both the articular surface are replaced, the head of the femur and also the acetabulum. This is the total hip arthroplasty. And lastly term in the surgical fixation and surgical orthopedic is the bone graft. Bone graft are used for both osteoinduction and osteoconduction, which is what's mean by osteoinduction. Osteoinduction, it is mean stimulation osteogenesis, and osteoconduction, it is provide as linkage across the defect and the scaffold upon which bone can be formed. Then bone graft can be act as osteoinduction and osteoconduction. We have different type of the bone graft. عندنا autograft, allograft, xerograft and artificial graft. Autograft اللي هو autogenous graft. In these, the bone is removed from one place to another in the same individual. يعني ناخذ بون من شخص إلى نفس الشخص. And it is either يا إما vascularized or non-vascularized. In non-vascularized bone graft, it is commonly used in which the bone removed with its blood supply. Without its blood supply يعني ناخذ العظم بدون الفيدينج blood vessel مالته. Example that thick portion of the iliac bone, greater trochanter, proximal metaphysis of the tibia. While vascularized graft, لا, the bone is transfers completely with its blood supply, in which anastomosis to the vessel at the recipient side. يعني ناخذه هو والنيرف سبلاي مالته ونوديه الى الاريا ونزرع الارتري مالته ويا الارتري القريب يم البون. مثل iliac crest لما تاخذه with one of its circumference, or the fibula تاخذها ويا البرينيال artery. طبعا ال vascularized graft remain completely viable and become incorporated by a process analog to the fracture healing. All other autograft undergo necrosis, although a few surface cells remain viable. بالnon-vascularized حوالي بحدود 80% من البون will be die. يبقى فقط السيرفيس اللي يشتغل as a scaffold and osteoconduction or osteoinduction. اما بالفاسكولارايز فكل البون جراف راح تاخذه it is viable لانه يشتغل as a fracture مثل الفراكشر. النوع الثاني من البون جرافت اللي هو الالوجرافت او هوموجرافت. هذا البون is transfers from one individual سواء live or dead to another of the same species. ياخذ من شخص إنسان ميت أو حي ويودونه إلى إنسان آخر. They can be stored in the bone bank and it is particularly useful when large defects have been filled. The antigenicity can be reduced by freezing or freezing dry or by ionization radiation. النوع الثالث اللي هو zero graft اللي هو الجرافت is obtained from the mammalian species like pig or the cow بهالحالة وهذه هسه ما موجودة. والcommon used nowadays is the artificial graft اللي هو الهيدروكسي ابيتيت اللي هو يكون على شكل pills أو على شكل كريم أو بيست أو على شكل chips أشكال ينخلط ويا البون جرافت وينزرع بالبيشنت. This is a different form of the bone graft. What the application of the bone graft? For vascularized bone graft, usually used for congenital pseudoarthrosis or non-union of the femoral neck, and lastly, when there is a large bony defect. While in non-vascularized, the main indication is filling the cavities. Number 2, filling the space after crushing of the metaphysis. Number 3, fusion. Number 4, atrophic non-union. Number 5, Augmentation, the compression site of the long bone fracture, which is being fixed internally. The last subject in this lecture is the amputation. Amputation, it is mean removal part of the body containing bone. We have three certain indications for amputation, which can be summarized by 3D. الدي نمبر 1 اللي هو dead، والدي نمبر 2 dangerous، والدي نمبر 3 nauseous المزعجة. Regarding the dead or the dying, in the peripheral vascular disease account about 19%, severe trauma, burn, or frostbite. While second is the dangerous, like malignant tumor, lethal sepsis, or crushing injury. The third indication اللي هو الدام nauseous المزعجة اللي هو the presence, meaning the retaining the limb may be worse than having no limb at all. The like pain, severe pain, gross malformation, recurrent sepsis, or loss of function. What are the variety of the amputation? We have three variety of the amputation: provisional amputation, definitive end-bearing amputation, and definitive non-end-bearing amputation. Regarding the provisional amputation, it is performed when the primary healing is unlikely. The limb is amputated as distal as the causal condition is allowed. Skin flap sufficient to cover the deep face tissue are cut, and suturing loosely over a back. Amputation is performed when the stump condition is favorable. يعني هذا النوع لما يصير مثلا بالحروب يجي لك مجموعة 5 6 كلهم يحتاجون amputation، فتسوي لهم provisional انه يو تشوبارد ذا لم وسوي له باكينج، وتجي له بعد 5 ايام 6 ايام 4 ايام لما الكونديشن تصير ويل، وراح تروح انه بسوي definitive stump ودefinitive amputation وسوي له suturing. اما النوع الثاني فهو definitive end bearing amputation is performed when the weight is to be taken through the end of the stump. Therefore, the scar must be not terminal and the bone must be not solid. Not hollow يعني should be solid. كل اللي جاي نشوفه احنا اللي يلبسون طرف وما يوقفون على البون وانما يوقفون على السوفت تيشو. اللي يوقفون على البون فقط either through the knee او Symes amputation through the ankle. بهالحالة لازم السكار ما يصير تيرمينال هنا، لانه بالحالة راح يصير ويت بيرنج عليه وراح يصير بيه ديهيسنس اوف ذا سكار وهنا راح يصير فايبروسيس. واثنين البون لازم ما يصير بيه هالو، يعني ما تقص على ما يطلع البون مره، انه لازم كورتيكال بون لانه الويت راح يصير عليه. اما الديفينيتيف نون اند بيرنج amputation is common variety. All the upper limb and the most lower limb amputated come into these categories because weight is not taking at the end of the stump, the scar can be terminal. طبعا سابقا كان اكو certain measurement for the amputation على مود الطرف. بالوقت الحالي وتطور الفيزيوثيرابي ظلوا يقدرون يصنعون الطرف باي level of the amputation، بس سابقا كان should be you amputated at least 12 سنتيم from the lower femur على مود تشتغل الني جوينت، المفصل الني جوينت راح يحطوه، او in the below knee amputation should be at least 14 سنتيم length of the tibia على مود البروثيسيس يقدر يلزم بالليج، or in the forearm should be at least 18 سنتيم of the ulna, and for the humerus about 20 centimeter from the shoulder joint على مود يقدر يلزم البروثيسيس. And lastly, the complication of the amputated stump. We have early, and late, and the early is the breakdown of the skin flap. This may be due to ischemia or due to suturing under excessive tension or in below knee amputation due to unusually long tibia pressing against the flap. Second, gas gangrene, clostridia and spores from the perineum may be infected a high above knee amputation. أما الليت complication فإذا ناخذها from the outside to inside start within the skin. Skin we have eczema is common and tender purulent lump may be developed in the groin, or ulceration is usually due to poor circulation and re-amputation at a higher level is then necessary. Number two, muscle. If two muscle left at the end of the stump يؤدي إلى unstable cushion, so thus induce a feeling of insecure which may be prevent proper using of the prosthesis. So if so, the excessive soft tissue must be excised. Number three, artery. Poor circulation give a cold blue stump which is liable to ulcerate it, thus re-amputation is recommended for a high level. Number four, nerve. And nerve we have a neuroma, which is mean a cutting nerve all allow forming a pulp called neuroma. Occasionally this is a painful and tender. Thus management by excise 3 cm of the nerve above the pulp. Sometimes it is needed to remove the pain or to eliminate the pain. And the second thing in nerve is the phantom limb, الطرف الشبح. It is the term used to describe that the feeling that the amputated is still present. هذا الشعور كلش مزعج لدى المريض انه يشعر ان القدم مالته او الايد مالته ما مبتوره ويحس بكل الشعور اللي كانما هي موجوده. It is very difficult to be treated. Number five, joint. The joint above the amputation may be stiff or deformed, and the common deformity is fixed flexion and fixed abduction at the hip joint in above knee amputation because the adductor and the hamstring muscle has been divided and should be prevented by exercise. فلذلك بس تشتغل الإليوسوس فتسوي flexion and والabduction تسوي abductor. And lastly, bone. Spur often form at the end of the bone, but is usually painless. Otherwise, it is need to be excised. And lastly, osteoporosis occur if the bone is transmitted little way and the bone become liable to the fracture. Such a fracture best treated by internal fixation. وشكرا جزيلا لحسن الإصغاء.